So hi, my name is Shelby. I'm the nurse practitioner who's going to be doing your physical head to toe assessment today. Is that okay with you?
Yes.
Okay, so before I get started, I'm just going to provide you with some privacy, and I'm also going to wash my hands. Alright, so before we get started, I'm just going to ask a couple questions. The first being, can you tell me your name and date of birth?
Ember Manna, April 9th, 1992.
Okay, and where are you and I currently located?
Lake Georgia Drive.
Okay, and can you tell me who the President of the United States is?
Donald Trump.
Okay, awesome. So I'm just double checking that you are aware of person, place, and time. Next, I will just ask you before I get started, are you in any sort of discomfort or pain?
No.
Okay, cool. So I'm going to move on to the head and face assessment, and I'm just going to take an overall look of your face. I see that your facial features are symmetrical. You have 2 eyebrows, 2 eyes, 1 nose, and 1 mouth, and they're all in the correct place. I'm looking for your skin tone, any color discolorations. I'm looking for any excessive hair growth. I don't see any of that. I don't see any noticeable lesions or masses on your face. Everything looks good. Before I move on to your head, is there any way you could just smile for me? Again, frown. And if you could just puff out your cheeks. Perfect. So I'm assessing the facial nerve and everything seems to be intact. So next I'm just going to take an overall look of your scalp. And I can do this by parting the hair and just kind of looking for any sort of scars or lesions that might be present, which I don't see any. I want to make sure that your scalp is movable from your skull, which it is, and I'm just palpating to make sure that everything is normocephalic, which it is. Okay, next I'm going to move on and just take a look at your eyes. The external eye looks great. I don't see any drainage or hordeolum. I don't see any excessive extension of your eyebrows past your actual eyes. They don't look too bushy or thin. I'm looking at your lash line. I don't see any discharge. I am looking at your sclera, which looks white and not yellow or showing any signs of jaundice. And I'm just going to, if it's okay, kind of pull down your eyes and look at your conjunctiva. They look pink. I don't see any sort of lesion, mass, or drainage. And then last but not least, I'm just going to take a look at your cornea. And I'm going to get this light so that I can see it a little bit better. And I'm just going to shine it really quick and just kind of look at your cornea. Hold on, make sure that it's on. Okay, so the cornea looked clear. No signs of extended dilated blood vessels or anything like that. So after that, I would also like to do a test with you. And what I'm going to do is assess for Perla. And what Perla is assessing for, I'm looking at first your pupils. They are equal, which I've already kind of done when I looked with the light, and they are also round in diameter. And I just last want to just double check that they're reactive to the light. So if you could just look straight ahead right at me. Okay. Perfect. And then last but not least, we're going to check for accommodations. If you could just follow the pen. Perfect. Good job. So positive Perla. So overall, so far the assessment is going great. And we're just going to move on to the nose. So I'm looking at your nose externally. I don't see any signs of redness or drainage around the nostrils, no irritation. I'm looking at your septum and it looks midline and intact. I'm going to get my flashlight and I'm just going to take a look if that's okay. There we go. Just on the inside, really quick. Okay. All right. So I'm looking in each bilateral nostril, and I'm just checking to make sure I don't see an excessive amount of drainage, any sort of irritation. There was no redness, and when I looked, I could see the turbinates, and they were not swollen or anything like that. Okay. So now I'm just going to take a look at your ears. I'm going to come over here and just look at the ear externally first. I'm just looking at the overall structure. I just want to make sure that there's no redness or obvious foreign bodies present, which I don't see any. I also don't see any redness or irritation. The patient has not complained of any sort of pain associated with ears. Is that correct? No?
Yes.
Okay. And when I'm manipulating the auricle, as well as other parts of the ear, there seems to be no tenderness, correct? Okay, cool. So now I'm just going to take a look at the inner ear. All right. Perfect. So I'm just going to go around to the other side and look at this one and do kind of the same thing. Also on this ear, I also don't appreciate any sort of redness, irritation, foreign bodies, no drainage like outside of the ear, and the ear is able to be manipulated. No pain or tenderness, correct?
Correct.
Okay, so now I'm going to take another look into this ear. Okay, so what I was looking for when I looked in the ear was just to make sure that the tympanic membrane was a pearly gray color, which it was, as well as the bony landmarks. All three of them, the incus, malleus, and stapes, were all present. When I was looking at the tympanic membrane, I didn't appreciate any sort of bulging or perforation. And as you said, you haven't had any sort of ear pain or discomfort. So I didn't notice any extra cerumen or irritation when I was looking in to the middle and inner ear. So now taking a look at the external part of the mouth. I'm looking at the lips. I don't see any cracking or lesions noted. Is there any way that you could just open your mouth for me? Okay. And can you move your tongue up and down? The roof, and then yes. And can you stick out your tongue at me? Perfect. And can you move it from the side to the side? Okay. Awesome. Smile really big for me. Smile really big for me. Perfect. Okay, so I don't see any overbite or underbite, and the patient is able to move her tongue. So I am going to further assess the inside of the mouth. Okay, so can you open up your mouth just a little bit for me? Don't stick out your tongue quite yet. I'm just going to kind of look at the buccal mucosa. Everything looks pink. No signs of redness, no ulcerations, nothing like that. Okay, no signs of gingivitis or bleeding. And can you stick out your tongue again for me? Okay, and can you say ah? Perfect. So what I'm doing when I have the patient say ah is that I'm actually looking back at the uvula and the soft palate and making sure that they both rise midline. The hard palate is definitely pink and showing obvious signs of the normal rugae, and the soft palate is smooth and pink. One last thing, I want to look in your mouth really quick. If you could just say ah. So I'm looking at the posterior pharynx, and I don't see any signs of redness or irritation. As well as I just looked at the tonsils, and they were both within the tonsillar pillars and were not swollen. I didn't see any signs of exudate. You haven't been having any sort of throat irritation or pain, correct? Okay, awesome. Now I'm going to move on to the neck assessment. So I'm first just going to inspect and just take a look and make sure that there's no sort of discoloration. I don't see any lesions or anything like that. The trachea seems to be midline, and I don't see any evidence of an enlarged goiter or thyroid. I would also just double check and see if I see any obvious jugular venous distension, which I don't. If I had any concerns, I could have the patient lean back and then come back up to 45 degrees. And if I noticed anything, I would note that and then further assess. Next, I would palpate the carotid pulses one at a time. Okay. Perfect. So both of them are equal bilaterally, and it seems to be a normal rhythm. I don't feel any thrill or anything like that. Okay, so now I'm going to move on to the thorax part of the assessment, and I'm just going to do an overall. I'm just looking, and I'm going to watch you breathe for a second, so you can just breathe normally. Okay, awesome. So I am just not appreciating any sort of increased work of breathing or retractions. I'm looking for any lesions or deformities, anything such as like pectus excavatum or anything of the chest. I'm not seeing anything like that. And then I would take a listen to the lung sounds. Can you breathe in and out for me? Again. 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 And one last time. Okay. Just going to come around to the back and listen back here as well. In and out. 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 Last time. Perfect. So I don't hear any sort of adventitious breath sounds, no wheezing, loud cry, or crackling. And while I'm back here, I'm just going to just double check for chest expansion. If you could just take in a deep breath for me. Perfect. And that seems to be equal and symmetric. All right. And then just the last thing, after we just listen to the breath sounds, which all sound good, I'm just going to check and just feel the temperature. It feels good, and I'm just going to check for skin trigger really quick, which is good. So no signs of dehydration or anything like that. So now we're going to move on to the heart part of the assessment. So the first thing I'm going to do is I am going to palpate the apical pulse. So that's at the 5th intercostal space on the left side, mid-clavicular line. Okay, so that feels great. No signs of heaves or lifts. And now I'm going to listen to all the different sounds of the heart. So I'm going to start at the aortic valve. Pulmonic. Second pulmonic. Tricuspid. And mitral. Okay, so we typically listen to the apical or mitral sound for a whole minute, and that would be the value that I would use. As well as this, I just want to note that the S1 and the S2 sounds were both heard. I didn't hear any extra heart sounds, no murmurs, gallops, or splitting or anything like that. And then I will also listen with the bell of my stethoscope really quick. Okay, no differentiation in that. Okay, so the next thing I'm going to do is just do an assessment of your abdomen. And the first thing that I'm going to do is just take an overall look of it. I'm looking right now for any signs of visible peristalsis, which I don't see any. I'm also looking to see if I see any sort of distension, which I don't. The patient's abdomen is flat in contour. I don't see any lesions or moles or anything like that. The umbilicus is central and everything looks good. So next I'm going to listen with my stethoscope. I am going to start in the right lower quadrant and listen for abdominal sounds. Okay, so I hear normal active bowel sounds. Anything of concern would be if I couldn't hear anything after 5 minutes in a single quadrant that I could. Are you having any sort of abdominal pain or tenderness?
No.
Okay, so if you were, I would make sure to assess that part last. But what I'm going to do is with my hands, I'm just going to do some light palpation, and then I'm going to follow with deep palpation, just see if I can feel any masses or anything that shouldn't be. Okay, and just let me know if you feel any sort of discomfort when I go a little bit deeper. All right, perfect. So I didn't feel anything out of place of the ordinary. If the patient had come in complaining of any sort of acute abdominal pain, I could also feel for the liver span border, as well as possibly feeling for splenomegaly or anything like that. But you're not, so that's fantastic. If you just want to have us sit up, I'm going to take a look at your upper extremities. So overall inspection of the upper extremities, I don't see any sort of lesions or bony prominences in the hands, suggestive of any sort of arthritis or anything like that. I just want to test a couple things. I'm looking and seeing that the diameter of both arms looks generally the same, as well as the length. Is there any way that you could just hold your hands out straight like this for me? Above your head. Okay, perfect. You can bring it back down. Can you make a fist for me? And spread your fingers apart. Okay, perfect. So the range of motion is great for a patient of her age. I'm not going to go any further in depth, but it's looking good. Okay, so now that we did some range of motion exercises, if I could just see your hands. And actually, if you could just put them both out for me, I'm just going to feel both radial pulses at the same time. Okay, and they both feel equal and bilateral, so that's fantastic. And last but not least, I just want to check your cap refill on your fingers. And those are less than 3 seconds, so you're being perfused all the way down to your fingertips, so that's good. So now we're just going to do a lower extremity assessment. Before I have you stand up, I'm just going to take a look at your lower extremities. I'm looking at the symmetry and the joints. The overall look of everything looks normal. The diameters of the upper and lower portions of the leg both look normal. The knees look normal, as well as the feet. I'm looking at the toes. They all are straight and in alignment. And I'm also looking at the arch of the foot, which both look normal. Do you have any pain with weight bearing?
No.
Okay, so if you could just stand up for me really quick. Okay. And just take a couple steps towards me. I just want to see how you walk. Okay, perfect. All right, and you can go back and sit down again. Oh. So another thing I just want to assess, if I could just see this leg really quick, is I'm just checking for any sort of edema, which I don't see any post-tibial edema. Let me just check this out. Okay. No pitting edema on either leg. And I'm going to take back this leg really quick, sorry. And I'm just going to feel the dorsalis pedis pulse, as well as the posterior tibial pulse. Okay, perfect. And if I could just have this leg really quick, I'm going to do the same thing. Okay, so both of those pulses are +2 and normal. I didn't appreciate any sort of lesions or anything, any bony prominences, anything suggestive of arthritis. or anything on the lower extremities. Last but not least, the lower extremities are warm in temperature, and I just want to check the cap refill really quick of your toes. Okay, less than 3 seconds. Awesome. So that concludes the lower extremity part of the assessment.